Hi, welcome to Ayirebuah Speaks Literally, the podcast where I share the random things and the random thoughts that shape my personality. Today's random thoughts, well, it is mental health. Mental health is a topic that touches all of us in some way, and so I'm excited to have two incredible guests with us, each bringing a unique perspective into this very important conversation. First, we have Vanessa a PhD candidate in clinical psychology based in the UK, and we have Maame Adjoa, who is a behavior. I'm trying to make sure that I say this word correctly. A behavioral health technician in the US, and a master's student in health psychology. Or I believe she's completed her master's by now, or she's about to complete her master's in psychology. So, in this episode, we're going to talk about their journeys, compare the differences in mental health care in the UK and the US. And seeing as we're all Ghanaians, we're also going to talk about Ghana's mental health approach as well. And then we'll dive into what the future holds for psychology and mental health. For me, I'm going to ask questions about technology as well, because, well, I'm a technology law graduate, and and so I'm just going to ask how technology also mends itself, combines itself with mental health treatment in our world today. So, whether you're curious about pursuing a career in this field, passionate about improving mental health care, or simply looking for insights into how we can better support ourselves and others, this is a conversation for you, and I hope you enjoy it. So, grab a cup of coffee because it's chilly over here. If it's hot, grab a cold soda, and let's dive into the conversation. My name is Ayirebuah.
Well, damn. Hello, how are you feeling? So glad you tuned in. Let's get to talking. Nah. Ayirebuah speaks literally. Yeah, she's speaking literally. About things like literary. Whether happy, scary, or teary, she'll have you feeling very merry. She's about to kill. Nah.
Hi, guys, welcome to the episode. Like I mentioned earlier in the intro, we're going to be talking about mental health, which is a very important conversation. And to, to help me with this conversation are two very important ladies, Vanessa and Maame Adjoa. Welcome, ladies. Thank you for joining me on Ayirebuah Speaks.
Oh, thank you for having us.
Yeah, thank you.
Okay, so before we start the conversation, just give us a little, intro. Who is Vanessa? Who is Maame? Tell the listeners so that they can learn more about you. So I'll start with Vanessa.
Okay. Well, my name is Vanessa. I went to secondary school, so high school with Irama. I I moved to the UK after high school, and ever since I've been in the UK, I've been studying psychology. So it's been about 10 years now of studying
Wow.
psychology. I'm currently doing my doctorate, my clinical doctorate in clinical psychology to become a registered clinical psychologist in the UK. I'm already a clinical associate psychologist, which is like the equivalent of physician assistant
Mm.
to a psychologist. So I'm already qualified as that, but I'm upgrading now to become the proper clinical psychologist. So it's a 3-year program, and I'm currently in my second year.
Well done, well done. Thank you, Vanessa. Maame.
Hi, my name is Maame. Sometimes I go by Mame in the US only though. But I'm a Rama's cousin on my mom's side, and I'm currently in my master's program where I'm on the health track. So I'm finishing up on my thesis, and then after that, I'm trying to find a job before I get into my doctorate degree.
Well done, Mame. In case you guys didn't know, I am Ayirebuah, and I'm going to have this conversation with these two lovely ladies. So thank you again for joining me. So let's get into the conversation. Um, Hold on. Let me gather my questions now. Okay. So my first question is, like you guys said, you've mentioned that you're pursuing, either already started pursuing a career in psychology, or you are still in the process of it. So the first thing is, what inspired you to pursue that career in psychology and mental health? Mame, let's start with you.
Okay. Um, well, while I was in undergrad, I was originally a math major, well, actuarial science to be accurate with it, but
Mhm.
I switched into psychology because I wasn't entirely enjoying the math curriculum. So while I started taking psychology, that's where I started learning more about it, especially with health psychology. So from there, that's where I wanted to pursue a career where I can help others with their health behaviors.
Okay. Vanessa.
Well, I think I decided to do psychology in secondary school actually, because
Mm.
I remember on one of I think it was a university fair or something. There was a university in the UK
Yeah.
that shared like leaflets or pamphlets about the
Yeah. I
university.
remember those
Yeah,
days.
and yeah. And then I saw like because I was studying visual arts. I really
Yeah.
didn't, I thought I'm going to be a graphic designer and that's it. But then I came across psychology, and then the summary for the course was that it's about helping people. So I thought, oh, okay, that's what I'm going to do. So I came to the UK and decided I was going to do psychology. And yeah, it's, you know, I, I guess my decision to pursue psychology, because it's a very long journey, my decision to still stick with it was also out of lived experience of mental health difficulties, my own personal experiences, and wanting to be of value to people who have been through things that I have also been through. You know.
Okay. Thank you. So now let's look at it. Right now we are away from home, basically. Let's say, but coming from where we are,
Mhm.
obviously as years have gone by, we can say that the conversation of mental health has become a thing, and people actually appreciate it a lot more than they did, let's say, even 10 years ago when you were in high school. So um what do you think is the most important thing to say when it comes to conversations where they say, you know what, this mental health thing, you are just making it a big deal. It's not too much of a big deal. Just pray about it. Just forget your worries. Just do this. Just do that. You'll be okay. You'll be fine. What do you think is the most important thing to say when people say that? Who
Uh,
wants to go first?
I can start.
Vanessa,
Or
okay, Mami
Vanessa.
can go.
Oh, I feel it's just important to let them know mental health is just as important as physical health. As like, you see with people who go through depression, anxiety, even stress, right? Like we all go through that with school work. It's important to like, remind, especially maybe those who are against mental health, that when you have it sorted or even learn ways to like um improve on it, it really changes your outlook in life and also how you are able to like, function as a human being.
Yeah. Mm-hmm.
Yeah, I agree with you, Mame. Really, mental health is also health. It's an aspect of health. So there's physical health, which people think is what health is, but health
Mm-hmm.
isn't. physical health. There's also mental health, there's emotional health, um, there is spiritual health.
Yeah.
So health is very varied. But I guess I understand why people say, mental health is almost as if it's a luxury. It's like,
Mhm.
well, at least from where we're coming from, it's often viewed as if it's a luxury, and I understand that, because in some ways it is a luxury. You have to pay for, psychologists and it's not
Mhm.
free. It costs a lot
Mhm.
of money. So part of changing people's minds is also perhaps looking at systems that have made mental health feel like a luxury rather than just a right, that people have the right to mental health care. And I think that much of the advocacy has to come from top to bottom. So looking at people who are in charge of systems, healthcare systems, policies, laws, whatever it is, that is where the work has to start from. But then there's also the individual work that we all have to do, regardless of our financial situation, regardless of our circumstances. At the end of the day, it is your health and it is your responsibility. Um, so perhaps what you have to do is to first of all deconstruct the idea that
Mhm.
mental health is a luxury, or that mental health is separate from health, because it's really part of health. And when you can start to sort of understand it in that way, you can try to find ways in the system to support you with your mental health.
Yeah.
Yeah, so
Yeah. Well
that's all
said.
I'll say.
Thank you.
Yeah, I agree,
And
Vanessa. Yeah.
yeah. Would you say that your academic path or your professional path has helped shape your perspective on what mental health care is? Is that a big factor?
Yeah.
Yeah,
Mm,
sorry, did
I
you
like
want
the
to go?
unison.
Yeah. Yeah, no. Okay, well, I'll go. Yeah, no, I agree. I think it's taken me years to really sort of even understand mental health within the African or Ghanaian context. It's taken me
Mhm.
a lot of time to understand that it's not a luxury, that it's not a rich people's disease,
Problem.
it's not a
Yeah.
white thing. It's taken me a lot of time. And certainly education has helped me tremendously, because now I don't just situate the problem within the person. I look at the
Mhm.
systems around them. And so in the past I would have said, well, it's all on you. If you're not taking care of your mental health, it's all on you. But how can it be all on them when there aren't system in place to help them with funding, to help them with medication, to help them with seeing a psychologist, with it's all of these systems. So it's really about helping people to see that I understand where you're coming from and why you think it's such a luxury or it's so difficult to get mental health care. But let's think about what we can do with what we have. While we try to push people in higher systems or levels of authority to change the system. But until then, let's sort of work with what we have, is the approach I use now.
Yeah.
Yeah.
Um,
Mari, what about you? Yeah.
yeah, going off Vanessa's point about like accessibility, what people see or perceive about mental health, I was able to learn about different like techniques while I was in school. And if I didn't have that experience, I feel I would have not been able to like, have that knowledge. And it just reminds me of people who don't like, have that accessibility to, the vast knowledge on stress management techniques and other ways to help with mediating any kind of like depressive or negative emotions. So like one big thing I like is mindfulness or meditating. Like that might seem as something far fetched depending on your culture, but it really does help just to sit down for a second. Like, and you can even pray if you're somebody who's religious. So yeah, just the knowledge is one way to like help with that.
Hmm.
Okay. Thank you both for that as well. So now my next question is, what do you think about the differences in the approach in the study of mental health? Vanessa, you're in the UK, Mama, you're in the US. How does the approach also, how is the approach important in understanding mental health? Do you think that there's a real difference?
Do you mean sort of differences in the way the countries approach?
Yes, yes.
Okay. Well, I'm not familiar with the American system, but I know that to become a clinical psychologist, it's a very competitive process because it's funded by the NHS, so it's funded by our healthcare system. So they pay for your tuition, and then you're paid a salary because you do have to work while studying. So it's a lot to juggle. But because it's paid for, it's very, very competitive. I remember you said you wanted to do health psychology. That one is not funded, unfortunately. So it's only clinical
Oh,
psychology that's funded in the UK. But forensic psychology, educational psychology, health psychology is not funded. Um, so because of that, it's very competitive in the UK if you want to train as a clinical psychologist specifically. And because it's very competitive, you have to sort of accumulate a lot of work experience. You have to have done a master's. So for instance, I had 2 masters because that's all the work I had to do to be able to get a space on a very competitive program. And then when you're from a minority, it's even more difficult. Your journey is longer, So, because I can say a lot about that, but anyway, let me stop myself. But so and so because of that, um, we have lots of clinical psychologists who are very competitive in nature, who are very perfect, come from a very perfectionist approach. And the thing about the way we study clinical psychology here is that we're not restricted to one model or one type of therapy. So we have different types of therapy. We have CBT, we have EMDR, we have DBT, we have CAT. So there are different types. The difference between a clinical psychologist.
you said so many things that I don't know. You could explain those things.
So basically, what I said was like, there are different therapies in that what I mean is, depending on which therapy you go for, it would affect the approach in which they treat you, because every therapy has a way of understanding mental health. So for example, CBT thinks that the way to alleviate mental difficulties is to think about or focus on the way the person thinks about the problem, how it connects to the way they behave, and then their feelings. So it's that sort of thoughts, behavior, feelings. So that's the way CBT approaches mental health. Whereas, for example, cognitive analytic therapy approaches mental health in terms of looking at the way people relate with themselves and one another. So its philosophy is that to alleviate mental health distress, you have to first go into the person's childhood. What were the key issues that they formed in their childhood? How did that relationship affect the way they came to understand themselves? And then as a result of that, how they relate with other people and understand other people. So depending on the type of therapist that you see, and the type of training that they've got, which specific therapy they've trained in, it will affect the way they view the problem that you come to them with. And I think that's one of my issues, is that a lot of therapists don't disclose which particular therapy they've trained in. They just say, I'm a therapist, without providing information about, are you a CBT therapist? Are you an E? Because the patient or the client needs to know that this is the type of therapy that the therapist is trained in, and then decide, is this kind of thinking about mental health, is this the way I want to think about my difficulties, or I prefer a different type of therapy? Does it make sense? So the difference between a psychotherapist and a clinical psychologist or a psychologist is that a psychologist has training in different types of therapies.
Okay.
Whereas a psychotherapist has a training in one particular type of therapy.
Okay.
So that's the difference. So most people confuse the two. That was the difference between a therapist and a psychologist. So a psychologist knows more about a lot of therapies,
Mhm.
whereas a therapist or a psychotherapist has just focused on one type of
One
therapy.
thing.
Yeah,
Okay.
yeah.
Okay. So it's true that your academic details has really put you in a more clear view of what mental health is.
Yeah.
Mame, were you going to say something? Yeah.
Sorry, I was listening to
The
Vanessa so
the
well.
question the question you forgotten the question.
Mm-hmm.
I think the question was about how studying, so yours will be how studying in the US, um the pathway in the US is.
Yes. So, I joined in psychology my junior year of undergrad, and
Mhm.
then I just went into masters. So I have more like knowledge of like what's required there. They expect you to finish a thesis, and with your courses, like they want you to apply theories and models towards like real world applications. So so in the beginning you start learning about different models. One big model we learned is the health belief model, theory of planned behaviors, just all these different theories and models. And I haven't started my PhD, but I was like researching about it. I know in the US it takes 5 to 7 years depending on which program you choose, and they focus more on like conducting longitudinal research. So like basically research that is going to take over 2 years or just a long period of time. That's why I wanted to take a break before I went to PhD program, because
Yeah.
here in the U.S., going off of Vanessa saying that they want them to work, I think some programs like want you just to dedicate your whole time to finishing your the PhD degree. So I know some students have like conflicts with that, especially with their finances. Uh, and I think in the U.S. there's been more resources to like towards mental health, um, especially in like I can speak on campus for students, especially with like community health clinics, and also there's a lot of like sorry, it's a specific name for it, but like basically a mental health counselor services. Like they have different ones pertaining to what students need. So like there's a lot of athletes on campus. They give them mental health services. They give people services for depression, um, anxiety. Yeah, it's just like abundance of it. So that's just I guess what I can speak for the U.S. side of psychology.
Okay. Thank you. So, now I want to understand these. I want to understand emotions.
Mm-hmm.
Let's bring emotions out. What exactly does the study of psychology or mental health tell you about anxiety, depression, hope, sadness, happiness, all those emotions? What exactly does the study tell you about it when a person is feeling all these emotions, whether at one particular time or the same things all together?
Um,
I don't know if my question is helping, but yeah.
I can try to answer. You let me know if I'm going way off. But
I wouldn't know.
so in the health psychology track, they focus on the biosocial social. Oh, I can't even say it. Biosocial. Social, yeah, the
Biopsychosocial.
biopsychosocial model. It's like a tongue twister, but yeah. And it focuses on physical and mental health with consideration of social and psychological factors. So I believe like looking at that, it helps to understand people on a different level as to why they or their interpretation of their behaviors towards like health. So like one big thing that like we learned in school with social factors is finance, where people live at, like their location or their availability towards certain health services, people's knowledge. That's also another thing to consider, because someone might not know what an insurance plan can how it can be useful for them, since they don't have like the knowledge of it. So I like that aspect of it, because you always just think it's oh, like if you're doing something that's like not good for you, that's the reason why, like, you're having a low quality of life, where it's like
Mm-hmm.
stuff you can't control, like money and all that can influence your overall health.
So money is the root of all happiness?
Maybe no. There's
No.
other things to, like, that can help your mental health that's outside of finance, but that can be a big barrier for people. So that's, yeah.
Mm,
Mm.
Yeah.
okay.
And just to add to that, I think, in America, there's a insurance system to
Mhm.
healthcare, which we don't have in the UK because healthcare
Oh.
is free.
Yeah, you
Yeah.
guys got that good.
Yeah. So for us, the biggest barrier to healthcare is long waiting list. Like
Mm.
you're just going to be waiting for a long time. It's free, but it's not as quick.
I
Mm.
had that experience today.
Yeah.
Like,
Oh.
It's not as quick. But just to go back to your question, I noticed that you said, depression, anxiety, hope, sadness. And I was thinking, were you sort of thinking that depression and anxiety were emotions?
yes. I believe that, yes.
Well, no, they
I
are not.
they are not?
They're
No.
not
Yeah.
emotions. And I think this is part, I do a lot of work with the faith community, and I love my Christians. I love my religious
Mm-hmm.
people. But sometimes, like when I listen to them speak about, depression and anxiety, and they say things like, as you are just deciding to be depressed, and, God hasn't given you sadness. And, there are two very different things. I really get upset when people mean sadness and then they say it's depression, because the
Mhm.
two are not the same. Sadness and depression are not the same thing. One is
Don't
a
they blend in though?
no.
If you have
No?
depression, that's like a whole different thing than being
There are
sad.
different types of
Mhm.
depression. So depression is a medical condition.
Mhm.
It's not an adjective. It's not a synonym or another name for depression, for sadness, sorry. It's a proper mental health condition that is diagnosable. So you have to be diagnosed in
Mm-hmm.
order to say you have depression.
Mhm.
And you have to you have to be experience a constant decrease in low mood every single day
Mhm.
for 2 weeks
Mhm.
constantly. So it's not like I'm sad today, I get money, I'm happy. No, that's not depression. Depression is even when the good things come in your life, even when everything is available to you, even when things are going well, you just can't seem to lift
Mhm.
yourself. Like your mood is just constantly so low every single minute of the day, every single day for 2 weeks. So if by week three you are fine, that's not depression.
Mhm.
If by day three you're fine, that's not depression. If by day seven you're fine, that's not depression. It has to be constant for 2 weeks. You see, so you see how that differs significantly from sadness. It's not the same thing.
Mhm.
And there are different types of depression, different symptoms of depression. There's depression that can look nothing like sadness.
Mhm.
Some people
Mm-hmm.
can be depressed and they are just hyper. They are
Yeah.
impulsive.
Mhm.
There's hypersexuality, drinking, alcohol, and it's a form of depression.
Mhm.
But if we always say that depression is sadness, we are going to be missing out a lot of people whose depression doesn't look like what we think it is.
Mhm.
So it's very important that we get that right. We understand the words we are using, if
Mhm.
we truly want to sort of advocate for mental health awareness. Anxiety, the same way, it's not the same as worry. Anxiety is
Yeah.
so much more than worry. There are different types of anxiety,
Mm-hmm.
so many types. You have to be diagnosed with it. You have to see there's a strict criteria in order to be diagnosed with anxiety. There's social anxiety, there's generalized anxiety disorder. OCD is a form of anxiety. There are different types of anxiety. So it's not the same thing as I'm just worried all the time or I'm having a panic attack, or it's panic attack is a different disorder on its own. So I guess what I'm trying to say is that I just wanted to use that opportunity to like make it clear that those are not
Yeah.
emotions; those are medical conditions. Okay,
Okay.
yeah. But on the topic of emotions, I really like what you said about the biosocial model. because we need to understand that medical conditions are not just an issue of emotions. Medical conditions are as a result of your biology, your psychology, and your social factors interacting. So you first need to have a biological predisposition. Okay, so that is the difference between.
Break it down for me. Break it down for me.
Oh my God, I don't want to sound like a teacher,
No,
but
no, you're here. Teach us, please.
Wait, they need
so
us.
your biological predisposition means that, for example, in your family, there's a history of, like, let's say, bipolar disorder. So it means that you have the biological predisposition likelihood that you could also get bipolar. But then having the biological predisposition doesn't necessarily mean that you automatically get it. It is when your psychology and your social factors are so bad, and that's what triggers the biological predisposition. Does it make sense? So that's
Yeah.
two people can go through the same thing, and one will have a mental health disorder and the other person wouldn't. It's not because the person who gets it is weak and doesn't believe in God, and it's not because of that. It's because perhaps there was a biological predisposition. Their social situation was not helpful, their psychological situation was not helpful, and that brought about the full-blown disorder. Doesn't make sense. So
Okay.
that's where
Yeah.
situations, sort of emotions sit. They sit within a biological, psychological, and social, like, interaction, if it makes sense.
Yeah.
Yeah.
Actually, Vanessa, that reminds me of when I took a psychopathology course. We were talking about like how social factors or like environmental factors can trigger people's like I think it was schizophrenia and bipolar disorder like in later years, and
Yes.
like you explaining it helped me to understand it more.
Oh, that's amazing. That is so true. And that's why
Mama, you're
sometimes,
welcome.
Thank you,
and that's
Arama. Yes.
and that's why sometimes people can develop mental health difficulties later in life, and they're like, where did this come from?
Yeah.
It was there. It's just that the situation wasn't as bad enough to trigger it. You see, so let's say people. I remember there was a time where there was a lot of university students dying by suicide, and then the story was always, oh, they had a broken heart and so they killed themselves. No, it's most likely that there was a genetic predisposition. The broken heart was just the situation to trigger that biological predisposition. So it was always there. There was always and that's why, there's this whole, like, don't take drugs, because you can end up, if you have a biological predisposition,
To trigger it.
It can
have
trigger,
it.
yes.
Whereas someone who doesn't have the biological predisposition will take the drugs and they'll be fine, and you'll be thinking, oh, me too, I can take it. I can take it, and they were fine. But then you take it, and then,
No, yep.
And then they'll say it's fearful.
Exactly.
Mame fearful is like house people, house witches, quote unquote.
Oh yeah.
Okay, so I now understand that
Yeah.
depression, anxiety, they are not emotions, and the emotions basically they might come out or they might show themselves in our biosocial
Psychosocial.
Biopsychosocial. Yeah.
Yes, I got it. So let me give an example now of a time where I felt sad when my environment changed. So moving from Ghana to the UK, and I'm sure you people have heard a lot of things that when people move here and they move here alone, they don't have family here, it can get very lonely. So there might be days that, oh, I've closed from lectures and I come back to my room and I'm sharing a house with strangers, so I can't even go out and start chatting with them. So I'm alone in my room. And so there's a feeling of every time after school, I'm sad, I'm lonely. The weather is not even appetizing to say, oh, let me look out the window and see the bright skies. No, the weather is also sad. So will you say that, or can that be one factor that if I had a biological disposition,
Yes.
this kind of situation that I'm in will then trigger whatever, you know,
mental
Biothing is in
problem.
mental
Yeah,
health is in my genetic.
yes,
I
that's
agree.
Okay.
exactly right. Yeah,
Mm-hmm. It kind
that's
of
Okay.
similar
exactly.
to like Vanessa's example of the students who started like, going through their personal problems and yeah.
Yeah.
Yeah,
Mm-hmm.
that's
Wow.
exactly it. Yeah,
Hmm. I
and
thank
that's
God that
Yeah, I was gonna
there's
say
no genetic.
aroma. Yeah.
yeah, that's a very good point because, same thing happened to me. I moved to the UK, very lonely. Unfortunately, there was the biological predisposition because my mom also had
Oh.
psychosis, and
Mm.
so now it's like I'm also full blown. Like I have lots of diagnoses, and I know it's strange because I'm a psychologist, and you have like, but yes, I do, But then understanding that it's not just a sort of like a you're not good enough or you don't have willpower or you're not resilient enough. It's a
Mhm.
combination of so many things: biology, my psychology. That is, what resources do I have available to me to bring joy.
Mm-hmm.
It's
Mhm.
so many things. And then my societal factors: do I have a community, do I stay in touch with people,
Mm-hmm.
all these things interact. So for some people moving to the UK, because they have all of those things, they have community, they have, they have things that make them happy, they won't be depressed. But some
Yeah.
people don't have that, you
Mm-hmm.
know, and then they might be on the edge of depression. But what saves them is that there's not that biological, you know,
Mm-hmm.
yeah.
Yeah. Okay. Good to know. Mm. Hopefully, I stay in the community
And you have a
because
community
it.
at home too.
Yes. But it does. But a lot of people complain about it on
Mm-hmm.
social media. They say, and people always say, "Well, then just come back home." But
Mm.
it's not. It's not as easy as that. Okay.
Mm-hmm.
So I guess so now. This brings me to um, another question: is how do you approach breaking down the stigma of mental health with your clients or within your community? Who was to go first? Itty bitty bitty.
Um, maybe I
Mommy.
can start because right now I'm still a
Yeah.
student.
Mhm.
Over well, last semester I volunteered at well, I had my internship at a community health clinic, and
Mhm.
one way I was able to like see different ways to like focus on healthcare. I said healthcare, sorry, mental health care was like diversity and inclusion. That's like a big thing, especially since my campus has like a big Hispanic population there. Is important to make sure like you have a knock down that language barrier, learn ways that health relates to um their ethnicity or their race, because that's also important. Like something that we're reading about in the book might maybe pertain more to a certain type of population versus like our own or you know other neighboring ones. But I just think diversity is very important, especially in the U.S. I feel the UK too, but in the U.S. I can speak for. Is like with
Mhm.
different, yeah, is important.
Yeah, no, I echo everything you said. Like you've hit the nail right on the head. Like for me, my work is not separate from advocacy. It's
Mm-hmm.
not, I don't separate the two. I'm not this psychologist trained by white people, and then I'm coming to my community and be like, oh, I'm coming to teach you all the white things that no,
Mm-hmm.
that's not the kind of psychologist I am. I'm the type that is always questioning, that is always asking, so how do we apply this to people from ethnic minority backgrounds,
Mm-hmm.
So I'm really glad that you're thinking about that, Mame, because we need a lot of representation in psychology and in mental health and the whole. We don't have lots of black psychologists in the UK.
Mm.
Uh,
Hmm.
so
Here in the
representation is,
U.S. too, yep.
yeah, it's very, very important. And I think for me, just to answer your question about stigma, I, I like to always come from the person's understanding. So before I can do any work on stigma, I need to
Mhm.
understand why mental health is so stigmatized to you.
Mm-hmm.
What is your
Yeah.
context? What does it mean to have a mental health condition? what would you lose as a result of that? Who would it affect if you were to identify with having a mental health? Until I understand the person's context, I can't then project like and say, this is what you should do. And I don't think that's the right, approach to mental health advocacy. We always need to understand, why is this such a big deal to them, and take it from there. So
Yeah.
for me, a lot of the work I do, especially in the faith community, is to understand what is the fear about being a Christian with a mental health condition. What is the fear about being a Muslim with a mental health condition? What is it? Is the fear coming from judgment from other Christians? Is it the fear coming from your community? Or is it like self-inflicted stigma? I want to really understand. And then there, I offer, you don't have to, whatever they're afraid of losing, I then offer hope that you don't have to lose that bit. It's just adding more tools. So let's say you're afraid that people will say that you're a weak Christian. Well, acknowledging that you have mental health difficulties doesn't mean you're weak. Rather, it shows how much you need God and
Yeah.
Yeah.
you need,
Yeah.
Yeah,
so it's
strong.
about,
Yeah.
yeah, reframing, as opposed to like, that is wrong, don't think that way. No, like, it's more about, let's think about this differently. Yeah, that's how I would do it.
Okay. Thank you both so much. And now let's talk about some challenges that you have faced. Um, so, Mami, for instance, when you were volunteering, what were some of the challenges that you faced um, while volunteering? And Vanessa, in your practice as well, what are some of the challenges you have faced?
Um, during my sorry, I said volunteering, but it was my internship. But
Oh,
during
okay.
yeah during my internship, I guess challenges I faced was like communication. I was like the new person in there. They seemed to know each other well, like the other workers there. So like I didn't want to like overstep my boundary, but I also, sorry, it's really windy over here if I'm breaking out, yeah, communication was a big thing I had to like learn how to overcome. Because another thing too is I'm 24 now, and a lot of them are older there. So like, how can I come up to and talk to someone that's way older than me, like as if they're my age mate? But I had to like get out of that mindset too. That like I'm also you know there to help out, and we're basically working partners. But that was just I guess that's the only challenge because I had a good experience there. But yeah.
With the students that you were volunteering with in the school, right?
Yes, yeah. It's a community health education clinic, so they give free services to students and the school's community, so anyone who lives there.
Okay, so but there weren't any challenges with like the students themselves that you were volunteering for. Sorry, uh, interning for. Yes.
Like in terms of clients or like people I was working with.
Yeah, the clients. The
Uh,
clients.
Patients. There's different.
Yeah.
There's different energies. Some people are like reserved, and others are just willing to tell you any and everything. So just learning how to like apply yourself or respond to them and apply yourself in those type of manners where it's professional, but also like you want to make it in a like have a good connection with them, because some people are scared to like go to receive health services even if it's free, because like the fear of doctors or not having a good patient and provider relationship. So yeah.
Get
Yeah,
that? Yeah.
similar things for me as well. I think for me, starting on this journey, the biggest barrier for me was the fact that I was from Africa, from Ghana, and I didn't know the system. Because I didn't go to their secondary school, and I didn't really understand the education system. So a lot of it I had to do on my own. I didn't know people. I wasn't connected to other psychologists to be like, can you read my application? I just didn't know people. So
Yeah.
everything I had to do on my own. And then you get into these spaces, and then you're a black woman who like can talk a lot. And when I talk, it's like I get you to think, because I'm questioning and I'm like, I don't accept things at face value. So then they're like, who is this black girl? And then she has an accent. So that's also another barrier. Um, yeah, so, but I'm here now. I'm doing the doctorate now, and it's still not easy. I think for me, the biggest obstacle is just af it's unbelievable, but after 10 years, I've not assimilated into the culture, and I'm in a very white area, and all my clients are white. So sometimes they say certain things about British culture, and I'm like, but I don't get what you're saying, but let's just pretend like I do. Um, so for me, the biggest challenge is I'm not from here, so
Mm-hmm.
it's been very difficult to integrate in that way. And then again, because most of my clients are white, because I'm in a white area, I'm always scared when I'm starting with a new client because I'm like, what are they going to think when they see that their therapist is black? And then she
Mm-hmm.
has an accent and she's from Africa, like what's an African therapist going to offer me? So I'm always I always have that at the back of my mind. But, you know, like you said, like being a therapist is like being a chameleon. You
Mm,
change depending on who you're talking to. It's a very relational job.
yeah.
Like
Yeah.
you're in the business of talking and relating to people,
Mm-hmm.
and studying people and making sure that you're getting the communication right. And sometimes, in order to have a strong therapeutic relationship with the client, you need to match their style.
Mm-hmm.
In that sense, you become a chameleon in that you change the color of your skin depending on your environment,
Mm-hmm.
and which means depending on the client you're talking to. So the style in which I'll talk to a client changes
Mm-hmm.
depending on who they are. And so in a day, if I'm going through 4 or 5 clients, imagine I've changed myself so many times.
Yeah.
It's a very tiring
Mm-hmm.
relational job.
Because it's very
And
tiring.
it's very difficult. It's very difficult. I think a lot of people think, oh, all we do is just talk to people, but
Mm-hmm.
it's not that easy. It's not
Mm-hmm.
just about talking to people, and especially as someone with lived experience myself. And then sometimes you have clients who are going through the same things that you are also going through. That is also
Mm-hmm.
very difficult as well. So yeah, those are my challenges so far.
Yeah. Okay. Thank you. So I wanted to ask a technology question because I did my master's in technology law, and I've learned that technology is, it's not even something that you have to learn. Almost everyone can see that technology is, weaving its way through every area of life.
Mm-hmm.
So my question is, how do you see the use of technology, or is technology being used in the world of mental health? Like, is there teletherapy, other mental health apps? um what are some of the ways that technology can, merge into mental health?
Um, I think what you said, mental health apps, that's like something anybody who has a phone or smartphone can be able to download. Um, I know like one big thing is like Calm in the US. People like using that.
Calm.
Yeah,
Okay.
Calm. I think it's like a mindfulness app. I don't have that, but like those type of apps help to like it lets someone able to practice those strategies like right there wherever they are. It might be at work, it might be home. So like the accessibility for it and availability is like really good. And another thing I want to talk about with technology was biofeedback. I don't know if you heard of that, Vanessa, like with the wiring and all of that. Like it helps people to like keep track of their stress levels and learn how to adapt to like improving it. And when I learned about that in school, I feel like it's something new. So like they're still trying to find or new innovations of how to like integrate technology with psych. And I think that's important too because, like you said, technology has taken over the world. So why not find ways to like help improve, like on something that we need?
Yeah. Okay.
Yeah, I agree. I think there's been a lot of advancement in terms of making mental health care more accessible. And
Hmm.
like, you're right. I didn't even know there was something like technology law. So yeah, I'm learning.
Yeah, I didn't know that too.
But yeah, you're right. Technology is everywhere. And if we want to make mental health more accessible, we need to think of, you know, ways to use technology to reach more people.
Hmm.
So I think if you're looking for skills, so like maybe mindfulness skills or breathing skills or, just um basic level one, like anxiety management skills or things like that. There's lots of apps available for that. But where the mental health conditions are complex, so like there's things like personality disorders, lots of trauma, complex trauma. Um, I don't think we need technology for that. I think it has to be traditional in the sense that you need to see a therapist that would be able to help you regulate and process those emotions in a healthy therapeutic way. Because it with technology, you're not getting that therapist feedback. It's just you and a device. So if it's like I just want skills to just cope in, just
Yeah.
coping skills, technology is perfect for that. But if you want to like process your trauma and talk about your childhood, no. I mean, I'm not an advocate for that.
But
Yeah.
I thought that some of these apps have like therapists in them, so you can get access to a therapist over the apps and talk to one like how we're talking now. You could probably talk to your therapist like that over the apps, or that's not how they work.
I know there's hotlines here for people who are like, I know it's mainly suicidal, but like it can be for any kind of like emotion you're going through, or disorder you're going through. So that's like one way to do like a tele um appointment. I don't know if that's the word, but like yeah, an online appointment.
Yeah.
Yeah, I mean, like there are lots of appointments that we offer online. So you can choose to have your sessions online or through a telephone call. And I guess that gives people like options. Let's say somebody is disabled and they can't come in person. Offering the session online is a best way to do it. But then you still have that feedback because you're seeing your therapist on screen, you're seeing their facial expressions, so you're having that feedback. Um, in terms of like those platforms, I think it's a way to connect with therapists. I don't think it's like maybe like
It's not
is
like
it
a
a
replacement.
yeah, no, is it a site to find a therapist? I'm not
Yeah.
sure, but yeah, there are crisis lines. So let's say you're suicidal and you just need to speak to somebody in the moment. There are lots of like crisis lines you can call. But in terms of if you want like therapy, like 1 hour sessions, those kind of things, I would say for the more complex side of things, maybe technology hasn't thought of a way to do that in an ethical way, as of yet, but we do have like technology for the more soft skills level one type of things.
Actually,
Okay.
going off of the online, I think technology definitely helped during COVID time to have online appointments with your doctors or therapists. But I know also people were complaining, or I saw like results saying that people were complaining about not having interaction with their
Mama, your
therapist.
sound is going.
Oh, can you hear me now?
Yeah.
Yeah.
Oh, okay, yeah. Yeah, so I think it just depends on the person because some people didn't like, doing it virtually. They liked being in person with their therapist or doctors. But I felt like it helped with COVID situation.
Eh,
Am I breaking out again? Oh, okay, I'm
it
done.
keeps going up. Okay. Is it the wind? I'm sure it's the wind. That's
Yes, it's snowing and windy here. Like,
oh. So now so basically we're saying that AI cannot take away your jobs.
no.
No. Okay. That's good to know. Okay, so before we wrap up this session, which has also been very informative, I must say, is there any other misconception? Like now you've taught me something about the depression and the anxiety not being emotions. Is there any other misconception you would like to clear up to anyone? Something you've learned during your studies where you yourself were surprised. You're like, oh,
I think what has surprised me so far is the amount of knowledge we need to have as clinical psychologists. So we do research as well, but not to the level of PhD, because with PhD, the whole of the 3, 4, 5 years is just research. But we do research like for a year, and then we have the teaching, and then which we have to do essays for, and then we have the clinical, which we have to go to placement for. It's a lot, and we cover things like learning disabilities, neurodiversity,
Mhm.
healthcare through stroke, fibromyalgia, all sorts of disease. And it's made me, I think what I'm learning is that psychologists can work everywhere,
Mhm.
that
Mhm.
psychology is not just limited to mental health. And
Mhm.
because of that, we don't, psychologists don't just talk to people. We're people that have studied to doctorate level. Well, most of in most countries have studied
Yeah.
to doctorate level, and so whenever we're offering therapy, it's coming from a place of what we've learned, what we've
Yeah.
Mhm.
experienced. It's not as simple as we're just talking to you and giving you
Yeah.
advice. And I really want to say this because there's something up in the Christian community, and sorry that I keep bashing the Christian community. There's something about I need to see a Christian therapist. But there's no such thing as Christian therapists. There's a thing
Mhm.
as a therapist who is a Christian.
Mm.
But a
Yeah.
lot of the learning we do isn't just tailored to Christian therapy. It's like I want to see a Christian doctor because they'll give me a Christian prescription, a Christian type of medication, a Christian. It doesn't exist,
Yeah.
you know. And I think
Mhm.
what people are saying is that, well, I can't go to a psychologist who has different beliefs because they are just going to tell me their opinion, and I want their opinion to be
But
a Christian, but that's not what it is.
Mhm.
We are not
mhm.
trained to offer opinions. Like when you come to me with a mentor, I can't tell you what to do. What I can do is help you to give yourself the answer you need.
Mhm.
So but it's not, we are not trained to tell people, oh, I think you should. No, that's not what we do. So
Okay.
if for the Christian community, if you're thinking, well, it has to be a Christian therapist, there's no accreditation board for Christian therapists. So somebody can get up and say, I call myself a Christian therapist, but who is your registration
Yeah.
body? Who is checking that what you're doing is actually Christian? There's nothing like that.
Mhm.
So
Mhm.
I just want people to be very careful because you can miss out on very good therapists because you are looking specifically for Christian therapists who will probably end up scamming you because all they are doing is just giving you their opinion because they've put Christian on their title. So we have to be very vigilant in that way. Ask questions when you want to see it. Not anyone who has put therapist in their bio is a therapist. Ask for
Yeah.
their accreditation. Ask them what kind of therapy are you trained in.
Mhm.
Because they may be trained in CBT and you
Different
don't want
types. Yeah.
CBT exactly. So ask questions. Do your due diligence. Ask them, I'm a Christian therapist. Okay, what makes you a Christian
Yeah.
therapist? What is your accreditation body? Even as a Christian, what kind of Christian do you subscribe to? Are you Methodist? Are you Jehovah Witness? Are you what? Ask questions.
Mhm.
Don't just accept things at face value because your mental health care is so important. You might end up causing more damage if you go to the wrong person.
Mhm.
So that's
Yeah.
what I want to say. Yeah.
Thank you,
I
Mame.
I agree. Yeah, so many parts I agree on, but I want to start with like how psychology. There's so many different specializations. It's, oh, can,
Mame, your sound.
can you hear me? Can you hear me?
Yes.
Okay.
Yes.
Yeah, there's so many different specializations to go into psychology. So I feel like that's a great thing, especially if you don't know exactly like what you want to do, because like maybe you're interested in science, so you could do maybe neuropsych, or you're interested in priming, like oh, um, can you hear me now?
No.
Can you hear me now?
Yes.
Okay. Yeah,
Is it you have to hold your
yes, I
laptop
have to
like this?
hold it. But yeah, I'm really happy about it having different tracks, because like I'm on a certain track right now, health, and I believe also to like going off of what you're saying, like it's important that we instill knowledge to the people, especially since there's a lack of knowledge with people understanding with healthcare and insurance, especially. Uh, oh my gosh, this is like the worst time.
Mhm.
Okay, yeah. But yeah, it's important to just keep people educated about mental health, so that within, throughout the years, and like into later years, we can be able to like normalize so many things that seem confusing about it. So it could be like being able to like access a therapist, or being able to access free health services, mental health services, like just having that knowledge. Basically, I'm big on that.
Thank you.
Mm.
So I picked up on one thing that Vanessa said, which is learning disabilities. And so I'll just like to take us back to how I think that growing up, I feel like a lot of our mates or a lot of our, this is coming from Ghana, I feel like a lot of our mates probably had some learning disabilities, but they probably brushed off because
Mm.
we didn't have the knowledge, or classmates will be laughing at the person thinking, oh, you don't know how to read, or you can't pronounce certain words, or you are seeing numbers, just basically we probably didn't know. And so I think that I don't know if it has really changed now, especially coming from like the basic education, if people are actually aware that this child might probably have a learning disability. So how can we help them rather than say, quote unquote, wabon, quote unquote, Mama, do you know what wabon means?
Oh gosh.
Quote unquote, it means you're dumb.
Yeah, I was about to say
I
like.
think, yeah. Yeah, so that's just basically my is it my question or my worry or my yeah. I just I just hope that it's still not the same as it was, when we were growing up.
Uh,
Mm.
It's
yeah.
sorry.
Oh no, I'll speak about later on because of the U.S. side, but yeah.
Yeah, no, it's still a very big problem, at least well in Ghana.
Mhm.
My mom she's in the education sector. She's no longer a teacher. She's an assistant headmistress, but she's taught for a very long time.
Mhm.
And even now, she still comes to me to say, oh, this student has this. Oh, and I'm educating, I'm sending resources, I'm saying like read this, do this,
Mhm.
Still a lot of misinformation. People don't understand. There's still the tendency to spiritualize everything.
Mm.
Everything is a spiritual problem. Everything is, so there's lots of education that needs to happen. There's a lot of learning and unlearning. There's a lot of like um I guess the people who know better, it's going to it get very tiring, but we shouldn't stop. We shouldn't stop
Yeah.
teaching. We shouldn't stop advocating. Sometimes it would feel like it's not rewarding. It would feel like people aren't even listening. But the more we know, the better we become, so that we can help and teach. There's no point of learning so much if you can't help and
If you
benefit
can't
other
help,
people.
yeah.
Yeah, so those of us who are privileged to have education, let's keep on teaching, keep on advocating, and not get tired, because we have a long way to go. And if we look to the people to say, well, they need to change, it's not going to happen. So we
Mm-hmm.
need to invest. Yeah, yeah.
Okay, Mama, what were you going to say?
No, I agree with Vanessa. Like, just keeping people educated. I think our generation is starting to do that more, especially like, you know, identifying different ways with children's development. Because previously, I worked as a teacher in a child care center, and they started to like pay attention towards children who might have like behavioral problems and might have like certain maybe like certain conditions are going on. Like it's like they have to maybe take in consideration that maybe this child is autistic or they have ADHD. So like knowing how to like not cross that boundary and diagnose a kid, but also to like learning how to like um, learn how to implement the knowledge of how to approach children with that into their programs. And I think that if we continue to keep doing that, it will definitely help with improving our knowledge of mental health. Oh, there.
The funny thing is,
I didn't break out,
when
right?
I mute when I
Oh,
muted
okay.
my mic, Mama's sound got better.
Oh,
so,
so
so
around
I
are
might be the
you? Yeah.
problem. I'll mute myself when you're speaking now.
Okay.
Okay. So now I think this is my last question actually. Is any advice that you give to students or young professionals who are looking to enter the field of psychology? Let me.
So I would say that it's a very long journey, but it's rewarding. Um, don't you first need to understand your why. It has to be more than self-serving. You have to do this job because you genuinely want to serve other people and not just yourself. If you're looking for quick money, this is not the job for you. This job is about people, listening to people's struggles and difficulties and having compassion. If you're somebody that feels like you cannot have compassion and sympathy for people, you have a very short fuse, you're not an understanding person, this is not the job for you. So you have to do lots of introspection. Ask yourself, who am I really? What are my weaknesses? Am I willing to work on those weaknesses so that I can pursue a career in psychology? So it really starts with you. It starts with checking whether you have the right temperament and characteristics for this job. And then once you feel that you can, and you feel that you have reasons that are beyond self-serving, then you have to commit to the journey. And it's very long, but have your community. I'm going to put myself out there. Connect with me. I'm happy to be your cheerleader along the journey. But please, don't be discouraged. We need people like you. We need more representation. You're valuable to this profession if you decide that it's the best thing for you. So that's what I would say. Yeah.
Thank you, Mame. I'll mute myself.
I also agree with Vanessa. Definitely um, understand the field you're entering because with psych, like there's so many different ways you can like go about like depending on your interest. And I feel it's also important to like form a social support group, especially if you're in school, because I can speak from my own experience, like having a couple of friends around to help keep track of assignments, projects, even meeting new teachers. Like I met some teachers that I wouldn't have ever came across if it wasn't for my friends. So like just being able to like work on your career as well as just gaining those experience as a student is important. And it's also important to do your own self research on like um, jobs. Like for me, my master's degree doesn't give us a license after to like practice, but there's other things that I learned that through while I was researching that I can like apply for after graduation. So just make sure you're like I think Vanessa said like look within yourself and just see how it applies for you. Like there's so many things to like go from in the field of psychology.
Okay, thank you both so much for your insights. Um, Again, if you want to change one thing about mental health care or the way that it is delivered, would you change something?
Oh, I guess I'm first person. um, maybe just towards the availability for people because I guess it varies because in the US they're doing a good job in my opinion to like try to expand it, but obviously there's some more work that needs to be done towards like insurance coverage and like I said like people knowing about it. So yeah, just to keep pushing it to others.
Thank you,
Yeah,
Vanessa.
I agree with you, Mame. I agree. Like, what I would want to change is to make mental health more accessible, but even more is to have quality mental health practitioners, people who know what they are doing, people who are following what they've been taught and not deviating from it and doing their own thing, people who are committed to giving people good experiences, not being non-judgmental, not bringing their own beliefs and stereotypes into the therapeutic room. So I want there to be availability, but I also want there to be quality therapists, quality mental health practitioners who do the job very well. Yeah.
Thank you so much, Vanessa and Mame, for joining me on this conversation about mental health. So today we've covered what psychology or the different types of, what first of all, I know that there's a difference between a psychotherapist and a psychologist, and I've learned about the differences between um disorders and emotions,
Mm-hmm.
and I've learned about the system, the way that it goes in the UK, and the way that it's being done in the US as well. And basically the conversation has been informative, insightful, and interesting, and I appreciate that you spent time to talk to me and my fans on this episode. So thank you once again. Do you have any last words for your fans? Shout outs to your fans.
Uh,
Oh, oh, I'm just happy to be
yeah,
here.
I'm grateful to be here, and everyone keep watching Arama's videos.
Yeah. Oh, I made it.
So thank you once again. So this has been Ayirebuah Speaks Literally, and today I spoke with Maame and Vanessa on mental health and psychology. What are some of the misconceptions that have been cleared up today in your mind? Don't forget to comment. What are some of you know the inspirations that you've gained from this conversation? Don't forget to comment. And what are some things that you can do in your own community or within your friends to enlighten them about the you know the importance of mental health, or take them away from the stigma of mental health? And again, remember, there are so many things that you can do with your mental health. Even as you have your faith, you also have to take care of your mental health, because your mental health is still health.
Mm-hmm.
Thank you for joining us on this episode. Don't forget to follow the podcast, subscribe to the YouTube channel, follow listen to the podcast on all your podcast platforms, share with your friends, and tell them about this very interesting conversation, because it's very important.
Mm-hmm.
So I'll see you ladies some other time. If anybody asks for part two, I'll call you. Thank you for joining me.
Thank
So
you.
say bye to everyone.
Bye.
Bye.
Bye.